What do you think of when you hear the words cardiac arrest? You're probably imagining someone clutching their chest before collapsing and being rushed to the hospital. At the hospital, CPR is being performed when suddenly the monitor screams and someone shouts, "They're flatlining!" The doctor runs over and yells, "Clear!" before shocking the patient. Everyone holds their breath and the patient miraculously recovers. But how accurate is that really? Let's go through it again. The first three are fine. Someone experiencing cardiac arrest can definitely have chest pain and pass out, and CPR is essential to keep blood circulating and provide oxygen to the brain. This is not how defibrillation works at all. To figure this out, we're going to have to go back to the beginning. This is your heart. It has 4 chambers separated by valves: the right atrium, right ventricle, left atrium, and left ventricle. The heart functions by the movement of cardiac muscle, known as the cardiac cycle. Diastole is the first stage, where the heart relaxes and fills with blood. Systole is contraction of first the atria, then the ventricles, forcing blood out of the heart. All of this movement is controlled and kept going by electrical signals conducted through the heart. To see the conductive system, we'll remove the vessels from our diagram of the heart. Conduction starts at the sinoatrial node. It's called that because it's in the atrium. It then goes to the atrioventricular node. It's called that because it's between the atria and the ventricles. Next, we have the bundle of His. It's called that because a guy named His discovered it. The conductive system branches off into the right and left bundle branches after that, and then ends in Purkinje fibers, a type of nerve cell which reach up the walls of the ventricles. But how does this all connect to our dramatic scene earlier? Cardiac monitors medical professionals use show a rhythm that represents electrical activity. Normally, it looks something like this. In a patient with asystole, there is no more electrical activity, leading to a flat line on the monitor. None of the cells are doing their job. Asystole cannot be defibrillated. To find out why, let's take a look at a rhythm that can. This is ventricular fibrillation. It doesn't look good. So what's going on here? For some reason, the conduction system isn't working, and so the ventricles are in control. They're not very good at it, and they're out of sync. The heart's just kind of wobbling. The big difference here is that VFib has activity. Defibrillation might shock the other cells into getting their act together. With asystole, we don't even have that much. Instead of snapping back into action, defibrillating cells in asystole leads to a vague shrug. Or to put it another way, the point of defibrillation is to reset malfunctioning electricity. You can't reset electricity that isn't there. Think of the heart like an orchestra. No amount of yelling is going to get music if the musicians are all passed out, but if they're just not paying attention, then you might be able to make it work. Thank you very much for watching. I'm Bella. I'm an EMT, a paramedic student, and a junior undergraduate. I hope you enjoyed the video and learned something new.